Hello and welcome to Medicine Made Easy, your go-to destination for simplified medical knowledge and insightful discussions. Here in this lecture, we will learn about the terminology of hypertensive disorders in pregnancy. Preeclampsia and other hypertensive disorders of pregnancy can significantly impact maternal and fetal health. Chronic hypertension is defined as a systolic BP greater than or equal to 140 millimeters of mercury or a diastolic BP greater than or equal to 90 millimeters of mercury before pregnancy or before 20 weeks of gestation. Use of antihypertensive medications before pregnancy or persistence of hypertension for greater than 12 weeks after delivery. Gestational hypertension is defined as hypertension that develops in pregnancy after 20 weeks gestation and resolves within 12 weeks postpartum. Preeclampsia is defined as new-onset hypertension that develops after 20 weeks of gestation and is associated with proteinuria or evidence of end-organ damage. Chronic hypertension with superimposed preeclampsia refers to patients with a pre-existing diagnosis of chronic arterial hypertension, either primary or secondary, who then develop preeclampsia during pregnancy. About 30% of women with chronic hypertension go on to develop preeclampsia during pregnancy. Diagnostic criteria for preeclampsia includes BP criteria and organ dysfunction, which identifies specific conditions such as proteinuria, hematologic, renal, hepatic, pulmonary, and neurologic dysfunctions. BP criteria: systolic BP greater than or equal to 140 or diastolic BP greater than or equal to 90 on 2 occasions at least 4 hours apart, or systolic BP greater than or equal to 160 or diastolic BP greater than or equal to 110, and 1 out of the 6 following new-onset findings. Proteinuria, greater than or equal to 300 milligrams per 24H urine collection, protein/creatinine ratio of greater than or equal to 0.3 milligrams per deciliter, or dipstick reading of 2+. Hematologic dysfunction, platelet count, 100 times 109/L. Renal dysfunction, serum creatinine greater than 1.1 milligrams per deciliter or doubling of baseline serum creatinine in the absence of other renal disease. Hepatic dysfunction, elevated liver transaminases, twice the normal concentration, or severe pulmonary dysfunction, new pulmonary edema. Neurologic dysfunction, visual symptoms or new onset, persistent headache unresponsive to medication and not accounted for by an alternative diagnosis. Eclampsia, a serious complication, characterized by new onset seizures in addition to preeclampsia, requiring immediate medical attention. Next is when to suspect chronic hypertension with superimposed preeclampsia. After 20 weeks of gestation, when there is a sudden increase in BP and new-onset proteinuria, or a sudden increase in proteinuria, we should suspect superimposed preeclampsia.
Thank you for listening. Please share and subscribe to my channel for more educating videos.